as most of you are aware, this is a webinar about running longevity, so how to perform for longer. Focus today will really be around how we can try and keep you fit, keep you running, try and give you as many useful hints and tips as we can from our experiences working in sport. I'll try and make it as interactive as possible via the chat box. We've got a poll in there at one stage as well, just to really try and tailor the information to the people that have logged on, and hopefully get you some really good information and a few tips, and keep you running for longer. So without further ado, so quick intro. I'm Ben Trevor Jones. I have been based in the UK for 5 years prior to now. I worked for the Derbyshire Cricket, Sheffield United Football Club, and then UK Sports Institute for a few years, and now back in Australia working for the Parramatta Eels, who are a rugby league team. So sort of dealing with quite a few running-based injuries at the moment. So hopefully I can give you a few useful points for your running. And then we've got Emily as well. So I'll let Emily introduce herself.
Hi guys, I come from a background, I've worked in rugby for a number of years, and then more recently working with the Sydney Swans in the AFL, which definitely covering plenty of Ks per week with those guys. I also come from a background, I used to play professional cricket with the Sydney Sixers, so I've been working in sport for over 10 years now.
Great stuff. So Emily and I will be your co-host, so we'll be sort of chopping and changing between a few slides, adding our own sort of experiences to the information we're sharing with you. So yeah, looking forward to it. All right, so what we'll be covering today, we've got how long can you run and play sports for? Very open-ended question. Number 2, common reasons for why people stop running and playing sports. So we'll go through, the next slide, we'll be going through a couple of injuries, which is the most prevalent physical conditions associated with the aging process, and then things to implement now to optimize your physical training longevity. On to our next slide. So how long can you run and play sports for? As I said, very open-ended question. There's quite a few factors which I'm sure you can all appreciate. And this is only covering a couple that I think are valid and worth sharing with you today. So you got your first factor, which is your optimal loading will prolong your running career. So listen to your body. So there's no perfect amount of loading. It's really dependent on so many individual factors. I think the best piece of advice I can give would be that listening to your body gives you a good gauge as to what the right amount of loading would be. I think a lot of injuries are overuse injuries. So listening and trying to adapt your training to how you're feeling is really important. And that's something that we do a lot with our athletes on a day-to-day basis. That leads to my next, that factor 2. So 70% of running related injuries are due to overuse, which I think all of you, that would resonate with a lot of you. It certainly resonates with me. I've picked up a few running injuries over the years, and I think you reflect and realize that maybe there was a bit you could do with your training load that might have helped manage those. Factor 3, so no evidence that high impact exercise will increase your risk of injury. I think that's a really important one, particularly if we consider the aging process. People would consider that, oh, well, I've run for many, many years, or I've completed high impact exercise, so therefore my risk of picking up injuries, particularly lower body injuries, would be higher, like those overuse type injuries. I suppose I'm leaning a little bit on like your OA type injuries, which is quite common. There's nothing in the evidence and in all the research to suggest that actually, if you've done a lot of running in your life, that your risk of picking up those types of injuries is any higher than the average person. So they've done some studies on 2 groups, one group that has run a lot more than the other, and looked at their instance. In this one, it was OA, for the development of OA, and there's no difference between the two. So try not to attach yourself to that. Of course, then, older age does increase the risk of certain types of injury, and that's just completely normal and something just worth considering. But there's not a lot you need to be doing about that, other than back to that first point, which is just listening to your body. And finally, and Emily will touch on this one in one of the slides to come, which is that past injury history is a very important factor. This is one that, particularly working in sport, we're very considerate of. If you're working with athletes, or we have athletes come to our clubs, one of the first questions is, what are their previous injuries? Because when you're looking at trying to predict any injuries that come up, their past injuries is always very highly correlated, and that's going to be the same for all of you as well. If you've had previous injuries, then they're going to be the ones that are most likely to recur. So actually building some injury prevention around those is going to be really helpful for you. Next slide. Right, common reasons why people stop running and playing sports. So we've got physical factors and non-physical factors. For the purpose of this presentation, we're definitely going to lean on just the physical factors and just injury for us today. Obviously, we'll recognize these other factors, which is illness, the non-physical factors, your psychological, environmental, and social, all very important to consider. But just for the purpose of the presentation today, let's stay with the physical factors and the injuries, which is why people would stop running and playing sports. So I'm just going to ask you all, if you could, to jump in the chat section and just share, if you're comfortable, just share your past or current injuries in the comment section, or if you'd rather, just a general injury that you'd be interested in hearing about, just so we can tailor some of the information to you. I'm just interested to see sort of what the group's, I suppose, managing at the moment, or things they have managed, or stuff they've been interested in. So yeah, if you could just jump in the chat box if you're happy to, and put any injuries you'd be interested in, or ones that you're managing at the moment, that would be fantastic. So I'll just give it 30 seconds or a minute. I understand not everyone might be comfortable with this, so if you're happy, just not happy sharing, that's absolutely fine. Cool, so got some Achilles in there, that's good. We've got that one in there, runner's knee, patellofemoral pain, ICB band syndrome, nice. Non-specific tendon, yep, dorsum of the foot, lovely. Plantar fasciitis. Cool. Calf and hamstring strains, excellent. What's your most common injury, Em?
I've actually got some plantar fasciitis at the moment, which probably a sign I'm getting a bit older as well. So I'm starting to learn that it's not a do as I say, not as I do. I've had to drink my own Kool-Aid a little bit and actually do some rehab on it, which is really annoying.
Because Shane made my calves too big. Emily, I've definitely noticed we've got a couple of athletes with these massive calves, and they're the ones that seem to always get the niggles as well. So there must be something in that. I think it's a spectrum. If your calves get too big, then it becomes a problem. All right. Yeah. Moving on. Look, I think most of that's covered. I don't have plantar fasciitis on there, but we can definitely we could potentially touch on that. Maybe just in the Achilles section, some of the management strategies sort of cross over between those two to a certain extent. But just to clarify, we've got runner's knee, patellofemoral pain, ITB band syndrome. They will sort of group them all together in the runner's knee section. A lot of the management's similar for those. So okay, let's move on to the next slide. Great stuff. Thank you very much for filling that. So why do they occur? I'm going to jump to Emily for this one. She's just going to go through a few of these factors.
Yeah, so I guess the first thing is that most simply, the load you're asking your body or a particular structure in your body to do exceeds its capacity to tolerate it. So there's some reason that a structure or your body in general is getting overloaded. I don't know what your experience is, Ben, but I find with our athletes that it's never any one thing. It's usually a bit of a perfect storm of a few different things building up. And the more of those things that you are exposed to at once, the more likely you are to get that injury. There's a few things that we can't change. Your age, There's certain things that at different ages, what kids are more likely to get is very different to your 60, 70-year-old runner. Females are always going to be a little bit more susceptible to certain things compared to males and vice versa. But the world we sort of are working in and where we think we can have the biggest impact and help people out is those things that we can change. Ben touched on it earlier. By far, I totally agree with you, Ben. By far, the first thing that we look at when we have athletes come in, because it's the most common thing, is what injuries have they had in the past? And that points us down the path of what we probably need to be adding into their program, because it's most likely where they're going to stumble. If you've had calf strains in the past, you're so much more likely to have calf strains in the future. So what can we do to prevent that, and why are you getting those regular calf strains? I think, not to overcomplicate it, simple things work well for a reason. If you're not strong enough, particularly in certain areas, those tissues are going to get overloaded quicker than someone who is stronger in those areas. If you've got calf weakness, quad weakness, hamstring weakness, whatever it is, you're going to be so much more likely to be susceptible in that area. I know, Ben, you'll touch on it a little bit more later, is the way you're running. And that comes back to, are we overloading a particular structure by the way you're running? Ben will go into that in more detail. And I guess we'll touch on a little bit more later as well, but by far what I spend most of my day doing, and 90% of my job, is training load and making sure we're getting that Goldilocks approach, where if you're not doing enough, if you try and go out and run a marathon tomorrow not having trained, you're probably going to get injured. Equally, if you're trying to run 4 or 5 marathons in a row and you're doing too much, you're also going to get injured. So it's trying to find that sweet spot that your body can tolerate, but you're also increasing your performance, and then gradually building up is probably the hardest thing. And I think the thing that not just everyday athletes, but the professional athletes get wrong, and that's where you get your injuries. And then obviously there's some environmental things, footwear, training surface, weather, and the type of event you're training for that can give you specific types of injuries as well.
Yeah, great stuff. I think I just lean on that, the low training base versus the high training load. I think a lot of, and particularly runners, it's the high training load, absolutely, that can lead to those overuse injuries that I talked about at the start of the presentation. But actually the low training base is a super important one, particularly people who have been injured. And actually maybe some of the mistakes from, and it could well have been the advice you were given, which is if you have any type of pain, you're trying to get on top of injury, like you come way down in your training base. And that's okay if it's necessary, but sometimes then you need to really build yourself back up very slowly, and much slower than probably what you think. And that's definitely something we do with the athletes we work with on a day-to-day basis, which is understanding, well, the longer time we need to sit someone out, the longer it takes to get them back in. So just keeping that in mind. Would you agree with that, Emily? Yeah,
I totally agree. I think, Ben, you would see it all the time. We have those players and athletes that come back from a big injury or particularly illness when COVID was floating around and things like that, and they've missed a few weeks of training, and then you try to play catch up, and that's when your Achilles and all your other little things seem to flare up.
Past injuries. Cool. Next slide. All right, so we're going to move into most prevalent physical conditions associated with the aging process. So we'll start with Achilles tendinopathy. I think there was a couple in the comments section. So what is it? It's tendon overload. I think in someone put around tendon management was an injury they were interested in listening to. And so I suppose some of these principles will apply to like the common tendinopathies we get in runners would be Achilles tendinopathy, patella tendinopathy, which is around at the front of your knee, and then also sometimes a glute tendinopathy, which is on the side of your hip. So what is it? It's tendon overload. It's structural changes to the tendon. So you can sort of see in this diagram, but normally your tendon is nice and thin, the fibers are aligned well, and it contracts really nicely with the muscle. With tendinopathy, it's essentially that the load you're putting through the tendon exceeds its capacity, and normally you get this breakdown and building up of the tissue, and then that process, that equilibrium changes, and then it becomes that you get these sort of different type of tissue coming into the tendon, not as structurally sound, and then you start getting that pain. That's essentially what happens across a lot of those tendons that you'll get, and you're running in the specific tendinopathies you get with running. Particularly for Achilles tendinopathy, reduced calf strength will be a major risk factor, because if you think a tendon is what attaches the muscle to the bony landmark, so for the Achilles, it's attaching the calf muscle down to your heel. If you can get that muscle functioning really well, the tendon will be better for it. And that's where your strength training comes in, but also just your general running load and managing that really well. In terms of tips for prevention, I love a little bit of calf strengthening post-run. So if you were to do your normal running load, actually potentially on your really big runs, that's not the time to do it. But if you have some of those runs, you do slightly shorter run, and you've got a little bit left in the tank, actually adding in some calf work at the end of your run when you're under some fatigue could be a really good way to bulletproof that tendon. As opposed in terms of managing your running load, so that 10% rule for increases in training is really important. And then you've got your cross training to manage tendon load. So I think that's a really important one. And that's a mistake that I personally have made as a runner, which is actually I've really focused on just running. And on reflection, it's like some of those runs, I really was just looking for some cardiovascular fitness improvement. So that's where I could have considered maybe a swim or a bike. And that would have been a really good option to try and manage the amount of load going through my tendon and giving those tendons time to recover while still getting a good training stimulus. We'll move on to the next one. So that's calf strains. I'll chuck over to Emily for this one, since she's got lots of experience with these in AFL.
Yeah, you're right. We get so many soft tissue stuff, and calves are a big one because of the high running load that our athletes are doing. I think there's probably two different versions. If you've had a calf strain or someone you know has had a calf strain, there's I was running along and I felt like I'd been shot and I had that ping in that big moment, or there's that calf that bit tight at the start of the run and it just doesn't warm up and it keeps getting worse and worse. I think calf strains are one of the ones that we see. Ben, you'd probably be the same, that they just, once you have one, they tend to recur a lot unless we can address the underlying reason as to why you're getting it. So I guess, what is a calf strain? The muscle fibers within your calf, again, it's overload. So those fibers become overloaded and you start to get these little tearing away of those fibers, and the bigger the strain, the more the damage there is. And what we want to do for the calf to get better is to give those fibers a chance to knit back together. As I said, it's mostly linked to overuse and high training frequency, particularly those low level ones that just don't seem to warm up. And a lot of it is that running at that lower speed, those longer runs where you're sort of running at that 70-80%, that tends to overload your calf particularly. So how do we stop them from happening? The amount of times I've had players come up to me and go, yeah, I just didn't feel right at the start of the warm-up. I thought it would warm up and it just didn't get better. And then they kept going, and then would you know it, they have that moment where it pings. So I think that's your body's warning sign, that if you do have that tight calf, listen to it. And it doesn't necessarily mean that you need to stop training altogether. It might just be that we drop off your load. Instead of going for your 10K run, we drop back to a 5K run for that day. Or, as Ben said before, jump on the cross trainer. You can do a swim or a bike, and you can still get the fitness benefits without overloading that calf. And changing 1 or 2 sessions is all it takes, rather than having to miss 2 or 3 weeks if you tip over into that calf strain area. Rest days are big. I don't know what your schedule with the rugby players are like, Ben, but our players never go back to back. We never run 2 days in a row. We really prioritize our rest days. We're making sure we're having really big training days and then a big deload day to let everything recover and regenerate. Running technique, and Ben will go into it a little bit as well later, but the longer the steps you're taking in your overstriding, you're actually going to load that calf complex a little bit more. And what we actually want to do is be loading higher up the system with those bigger muscles. So your quads, hamstrings, glutes, and those shorter strides will help you load those bigger structures and not make the calf do the bulk of the work. And as Ben said before, calf strength, I think runners want to run, football players want to play football, tennis players want to play tennis. But don't forget your strength. It can be really, it doesn't have to be long. It takes 5-10 minutes. It can be really useful preventative and protective factor in preventing these type of injuries, particularly when you've already had one. To rebuild that strength is really key.
Great stuff. Yeah, that's awesome, Emily. Yeah, in terms of just what you said around back-to-back days, yeah, absolutely. Like when we're rehabbing players back in, the back-to-back days is normally the last step, if that's part of our training schedule. So if the expectation for our players is to go back-to-back, well, when we're bringing people back in, yeah, that's the last step. That tends to be hard. So keep that in mind, everyone, with those back-to-back training days. Like, it's tough on the body, like it can be done, but yeah, if you're struggling with a bit of a niggle, consider, if that's something that's in your training routine, consider bringing that out as an easy one. I don't know about a lot of you. I think a lot of runners, like, we're chasing that runner's high. We like feeling like exercise might be part of our routine. Again, that's where the cross training or swimming or bike, if you have access to those things, can be really helpful. Or like that strength training session, or dare I say, even some yoga or stretching, just to try and stay in the routine, to change it up from running, rather than just going, well, I'm not going to get up and go for that run, or I'm not going to go for that run in the evening. Just switch it in for something else. And that's what we do here day to day with our athletes. It's, if you're not training, we're still doing something that's just going to be more productive for the place they're in. Right, runner's knee. Do you want me to jump on this one, Emily, or do you want to do it?
I'll go. I'll go. So I think, like you said before, Ben, it can be sort of have come across with a few different names, and you can sort of lump everything in together in terms of how we manage it, to be honest. But I think how it tends to present is people just go, just my knee, the front of my knee, it's a bit sore, kind of gets worse as the session goes on, doesn't warm up. And it just feels like things are grinding and just rubbing and doesn't feel great. And basically what that is the structures around the knee, so the muscles, particularly quad muscles and particularly the outside area of your quad, get quite tight. And how your kneecap sits on the front of your knee, when the quad muscles coming in over the top get tight, it just compresses that kneecap down particularly, and often it can be more to one side. And then you get to some friction and some irritation of those tissues underneath the kneecap, particularly the cartilage at the front of the knee. Really common again with high running loads, really common if you've got particular weaknesses, particularly through your glutes. And if you're someone who's super tight and stiff, it's actually a really easy one to prevent or to help treat. Jumping on the foam roller, getting through your quads and your ITB, just to free up those structures, to give yourself a little bit more room at the front of your knee. So loosening up the front, but then also strengthening up the back. So getting those glutes going to make sure that those quads actually aren't taking all of the load, that you're getting some power and some control through the back of your hip there. Are two really easy ways to get on top of this one.
Yeah, nice. I see we've got an ITB band syndrome when we did the Q&A. Just to clarify on where that one sits. So this is your patellofemoral pain. So this tends to be pain at the front. With your ITB syndrome, it tends to be on the side here, and the ITB is a band of fascia. So it's really stiff, and it sits on the side of your thigh, which I'm sure you're aware, because that's where your pain will be, down the side of your knee. My classic prescriptions are definitely foam roll, ITB, but also like trigger ball into your glutes and glute stretching, because your ITB runs off the glutes. So actually, you're not going to get much stretch from the ITB itself. It's more the glutes, which it attaches to, where you get the most effect. And then also, amongst other things, it's that glute strengthening and lower body strengthening, and making sure that knee's in a good position when you're doing that strengthening is really important. Right, moving on to our final one that we've got in these slides, which is just our OA. So I'll lean a little bit on knee, but this would also apply to hip, and then even some foot OA, which can be quite common in runners. So what is OA? So thinning. It's the thinning of the joint cartilage. So if you can see on this X-ray here, you can see on the right that closing of the space. So on the left, you've got normal joint space. That's where your cartilage would be sitting to try and it's that smooth water-like surface, almost quite spongy, and it's good for shock absorption. And then also just allows these bones to move without too much friction. And as you can see on the right, you lose that, and the joint gets stiff, and you can get swollen, etc. And I'm sure if anyone on here's got OA or has been diagnosed with that, they'd be aware of it. As I mentioned at the start, no link to repetitive high load activity such as running. So there's nothing to say that it will increase your risk of OA by being a runner. The biggest predictor, unfortunately, is previous traumatic injury, which a lot of you may have had. So I think we've got someone in there who may have a torn knee ligament. That's not at all to say that you're going to get OA, but that's just an important factor for it. So if you're someone who and previous traumatic injury in your knee would be, let's call it like an ACL tear, for example. That's one that we're familiar with managing. That is going to increase your risk of OA later. That's nothing to be fearful of. It's more that you just need to, again, thinking about our past injury history, something you need to factor in. And like when you're managing your running loads or exercise, or whether it be other sports like, say, tennis, it's important that you're just aware of it and you're factoring that into your process. Then if you've got a physio you see, or you've got someone who you help manage your loading patterns, you can have that discussion with them and just making sure you're looking after it as best you possibly can. Tips for prevention. There's so much research on OA. Maintaining your lower body strength or improving if need be. The muscles provide the shock absorption for your joints, so that's super important, and there's some great evidence for that, even if it is a little bit sore at times. And then also training, periodization, and recovery. So cartilage health. Thinking about actually going, well, the cartilage in the knee, it's a tissue, so you need to load it and you need to give it time to rest. So that fits into what we talked about with training load. Making sure you're giving yourself time to recover after runs, and that's leaning on those back-to-back days as well. And then body weight management and high BMI. So keep in mind, I'm not saying this is very different to being overweight. It's sometimes if you're a bigger person, there's more load going for your joints. And if you know what your normal weight range is, actually, if you're getting a little bit of pain in, say, knee or hip, and it might be associated with OA, some really good evidence to go, well, if you actually just try and bring that weight down a little bit, you're going to take a little bit of load off those joints, and that can have a really positive impact. So worth keeping that in mind. And I thought it was a valid point. Right. Just quickly, we're going to do a poll. So before we go into can running related injuries be prevented? I just want to know, so I've just started it there. I just want to know what distance people are running. So if you could just jump on the poll section, hopefully that is easy enough for you to complete. Just to get a bit of an idea, because I suppose we are tailoring our message a little bit to your longer distance runners, but just want to make sure I'm not missing too much here. I'm aware we have some people who aren't running as well. So who are like playing sport more so. So just if I suppose if you run for training, or if not, just feel free to fill out either one or leave it blank. Yeah, cool. So we've got 13 votes. No sprinters amongst us. We've got a couple of middle distance, and then 11 out of 13. Cool, longer distance. Great. Thanks very much for that. All right, so yes, they can. They can be prevented. Of course, they can. It's a multifactorial process. The points we're going to touch on are tailored strength training programs, running technique, training load management, stretching and mobility, and recovery methods. So strength training, keep them individualized. So really thinking about your injury history, what things you need to work on to try and get the best out of that strength program. So if you're a runner, generally you're going to do lower body exercise. As just a general rule, try and consider, break your lower body exercises into sort of front and back. So you've got your exercises which are a little bit more like quads dominant, and then you've got your exercises which are a little bit more like hamstring glute dominant. So quads dominant is going to be more like your squatting variations. So like your lunge, your normal squat. With your more hamstring glute dominant stuff, that's going to be more of like a hinge pattern. So consider like deadlift patterns, But a deadlift doesn't need to be really heavy. You can do like your single leg RDL type variation, which hopefully people are familiar with, which is going to be a bit more hamstring glute. Alternatively, even if you're someone who leans a bit more on machines, like your hamstring curl machine's a really good one, or actually just like glute bridge variations, those types of exercises are really important, and have a nice balance between both of those. You're going to get a protective effect on the joints. I think I mentioned that in the OA section. Improve shock absorption when you're running. So having strong muscles will help protect your joints. And then also with tendinopathy, I know we've got some people interested in tendons. It strengthens the musculo-tendon unit. So actually strength training is really, really good evidence to go, if you're getting sore tendons, actually increasing your muscles capacity will have a really good effect on that tendon pain, but then also reduce your risk of developing a tendinopathy. The next one was just cross training, which I've alluded to a few times, but it can reduce your overuse injuries by you training opposing muscle groups a lot of the time. So if you're running, you're just using the same tissues in the same way a lot. So actually changing it up and using those muscles slightly differently. And that can also include strength training variations. Just trying to use the body differently. Don't use it the same way all the time. I think that's really important. And that's something we apply in a sport context a lot. And I think as a physio, I've had some really positive effects with that on people. Actually going, well, if you're doing a lot of loading in the knee, let's say like bending your knee, well, actually doing some loading where we're straightening and coming out of that position can be really helpful. It helps you maintain your aerobic fitness without compromising tissue recovery. So all that means is if you want to work on your fitness and you've got a certain goal, these are for your long distance runners, actually going, I'm going to have a bit of a break from running today because I'm a bit sore. Well, can you do a similar type of session? So if you're going to go out for, say, a 40-minute run, can you find a way to do a 40-minute session, perhaps on a bike or a swim? I'm wary that we don't have a lot of access to those things, but they're just good options and something we use a lot in sport. Consider also the top-up option as well. So actually you can split it. You can still go for a run. You can do a little bit of cross-training as well with it. But I'm wary this is all very dependent on individuals and whether you have access to these things as well. Moving on to our next one. Running technique. I'll chuck to Emily for this one.
Yeah, so I think we were talking about it in a lot of our different injuries that your running style leaves you at risk to a lot of different injuries. And part of that will come back to your strength. Do you have enough strength to run with good technique? But also, are you overstriding? That always links you to more calf, Achilles, overloading those lower structures, trying to get to, and it's really simple things. I think your local physio, or there's some stuff we can help with in terms of getting you in a good position that we're using the right muscles at the right time. That you can see in the picture there, that hip drop. So usually that's a sign that you've got some glute weakness in there and you're not nice and stable through that stance leg, and you're getting that drop of your hip, which is overloading everything else. And a really easy way to fix it is to think shorter steps, but also to try to run with quicker steps, not just run faster, but more steps in a minute or in 30 seconds seems to help with that good technique, making sure you're nice and upright. And I think where it particularly becomes important is as you fatigue, particularly in your longer runs, that running technique tends to go out the door. But if you can kind of remember those two cues of the shorter steps and quicker steps, that'll sort of hold you in good stead.
Yeah, and I've looked into like a lot of the research around this, particularly when I've been trying to help runners, and I think that there is a little bit of chat around like strike pattern and like where you should be hitting on your foot. And I think it's very risky to make changes to that. And I'm not going to go into detail on that, but there does seem to be a consensus that actually increasing cadence, which just means taking shorter, more frequent steps, can have a really nice effect on just reducing some of that load through like your knee and your calf. And then you've got that contralateral hip drop as well, which is, as you can see in this photo, so the one on the left, where if you think about as she's hitting the ground with that left foot, that opposite hip is staying at a similar level. So that means these muscles around her hip are working, and then also the ones acting on the knee and ankle are working really well to create this nice stiffness through that leg and that hip. Whilst on this side, as you can see, it's tilted. So this person's going to be a little bit more prone. You can see that knee angle, more prone to your runner's knee type of problems, and then also around the hip and all the way down to the ankle. And actually working on these things, so trying to keep these hips level during running can be really helpful in terms of trying to manage those lower body injuries. And then you've got training load management. So as Emily and I have talked about, back-to-back running days are tough. So it's really important to consider how important those are to you. But then also, if you're struggling a little bit with niggles, consider managing those. Try and schedule a monthly 50% deload week. And I think this is a big one that people potentially don't do that often. Perhaps that's just partly due to the planning process, but that's really important. It doesn't have to be too structured, but actually just trying to listen to your body. And that goes back to the first point I made at the start of the presentation, which is if you're feeling a bit sore and you can tell you're waking up and you're a bit more fatigued and tired, find that deload week or a deload few days and drop your normal amount by about 50%. It'll feel a lot, but you'll feel way better for it the next week. Would you agree, Emily?
Yeah, and I think everyone thinks that we do it with our athletes. We never go more than 4 weeks without a deload week, and everyone thinks that these athletes are training more all the time is going to make them better. And it's the same with people who are trying to train for marathons and those longer distance or any race, is that you need that deload week so that you can't keep going up. You've got to, you build, you have a little rest, and then you can do more. It actually allows you to do more by getting that little deload in. And the athletes at the top level, will rarely go more than 4 or 5 weeks without that deload.
I just wanted to make a point around be wary of the strict training schedule. So there is some evidence to say that people who stick to a training schedule too religiously will often be more prone to injury. And it does make sense, even though it does fit with what we're talking about planning your training load. If you say map out a plan and you're going, right, well, I'm going to train on all these days, and you're a motivated person, and I reckon if people who are on this call, most people probably are very motivated and keen because they're actually, you're here trying to understand how you can try and keep running. That's a really important thing to consider. So being flexible with your plan is really important. And again, dealing with athletes, they require that, and it's hard for them to come away from a plan. When I was with the Institute working with the kayak group, I know it's different to running, but similar type of loading patterns. Yeah, we did a lot of work on just trying to be flexible with the plan and helping them understand that actually listening to your body is really important, and not like we can still get to the end goal sometimes through a different path. Final one, I'll let Emily touch on the stretching, mobility, and recovery methods. Emily?
Yeah, so I think it's the most undervalued part of it. Everyone thinks they don't have time, but it's pretty easy to sit on a foam roller or a trick ball while you're watching 15 minutes of TV, and it can have a really big impact. We need to make sure that you actually have, everyone talks about commonly strength and load and things like that, which we've been spoken a lot about, but you actually need to have the range in your joints to be able to do what you're asking it to do. And it also gives you a bit of an idea as you're foam rolling, stretching, whatever it is, of the areas of your body that are a bit stiffer and a bit sore and that might need a little bit extra attention. And it'll help with that running technique and how you're moving. If there's certain areas that are tight and you can free them up, you'll actually feel better when you're moving and feel like you can get in those good running patterns. And I don't know what it's like in the UK at the moment, but I know over here it's really in vogue, these recovery centres and recovery hubs and your saunas, your ice baths, your plunge pools, which there is some really good research about it. But with our athletes, we've actually found that if we do nothing else in terms of recovery, if they're getting good sleep, they're getting 8-9 hours of sleep. Those are the ones that don't get injured. Our players that regularly don't get good sleep are the ones that get injured. And I think if you do nothing else in terms of recovery, that's the one. And the other one that we have issues with is fueling. And when you're doing those high training loads, you actually underestimate how much fuel and how much nutrition you actually need to get in to be able to do those high training loads. And we had a few bone stress injuries over the last couple of years, and we didn't change anything. We didn't change too much with training load. What we really had a big focus on was getting good sleep and good nutrition, and it's really dropped off our injury rates really significantly. And I think when you're working, which some of our athletes are working in uni and life, and you're trying to train on top of that, particularly if you're training for an event, the fueling and the sleep tends to be the first thing that goes out the window. So you're overloading on the training aspect, but you're not giving yourself the time to be able to rebuild back up. And then obviously there is some really good evidence coming out about those recovery hubs with the ice baths. I don't know what sort of protocols you use at the Eels, Ben, but we have a couple of different ones. We have some hot cold where we alternate 3 minutes in the hot, 3 minutes in the cold, and do that through 3 or 4 times, but then also a straight up cold immersion for 11 minutes. So up to the shoulders, jump in the ice bath and see how long you can go for it. And the research is about that 10 to 11 minutes gives you some really good results off the back of it.
Yeah, we're very similar, and I'd encourage the people on here to, like I personally don't really have access to an ice bath, but I enjoy the hot cold method as a recovery tool. So you can do that with a shower. But then, there's lots of different options for you to try and get that cold water therapy in. But yeah, I think try it. Like, we're quite individual with it. Some of the athletes hate it, and they just it creates such a stress for them that it's not worth it. But for most of them, they absolutely love it, and I think it has a really positive effect. But as you've explained there, Emily, like, that's such a valid point around sleep. Just and actually planning that and getting your sleep hygiene really good and going to bed at the same time, and just trying to get that 8 hours. I think you can't beat that at the moment. Don't try and tick it all off at the same time. Just if you can get your sleep right, and then you can start playing around with some of those other strategies. And then also, of course, nutrition and hydration. Yeah, you make a great point around how I think we tend to underestimate how much nutrition and food we need, if particularly people up their training and not actually plan to up their eating. So. And that's all we've got today. Thank you so much for listening. We really appreciate everyone coming on, and hopefully there's been some really good information coming to you. We'd love to take any questions that you've got, or if there's any injuries that we've not covered yet. We'd be really keen to hear. So we'll stay on the line. Feel free to jump in the chat box, and we can go through anything that perhaps we've missed, or if you've got any questions you want to clarify. But yeah, if there's not, then we'll finish up there. But we'll stay on for a couple of minutes.
Ben, are you training for anything at the moment?
I'm working. I've had a little bit of lower back stiffness. So I've been just trying to mix it up a bit. I'm actually doing a fair bit of swimming at the moment. So I've built myself up I'm nearly up to a K, which is previously I'd do 50 meters and be cooked. So we've got just around hot cold protocol that we use. So the protocol we use is the same as what Emily said. I think you can go like 3 minutes, 3 minutes in cold water immersion. So we've basically got the showers and then the ice bath. So they'll just go 3 minutes in the ice bath, 3 minutes in the shower, times 4. But in terms of like what you could do just at home in the shower, you could actually just shorten those time frames. So you could just go you go 1 minute on off between the two for 10 minutes. That can have a really nice effect, and I'd encourage you to try it. Have you got anything on that, Emily?
No, that's bang on what we use. We do, particularly in Australia, we've got the hotter weather, so it's a bit easier. We tend to try to finish on the cold. Might not be as enjoyable in the middle of winter in the UK, but yeah.
In terms of like when we'd use it, definitely on your high training days. That's when I'll be using it. That's when it's most good. Like we most commonly recommend it for our guys immediately after the game, and then the next day as well, as part of your recovery tool. Right, is it worth scheduling a physio massage on a regular basis every 4 weeks? If yes, should it be done in the down week? Great question. Look, I think there's some massage is super useful, particularly like with runners. You tend to have like really tight muscle tissue. In terms of down week, I think that's individual preference, to be honest. Like we schedule massage. We have massage therapists that come in and work with us. We schedule them like every week, but we actually have found this season that we need to have different time slots for different people. So to answer your question, John, I would say that try the down week as a starting point, but it's really up to individual preference. Would you agree, Emily?
I think there's definitely no downside to having a regular one in, for sure. And like you said, Ben, it's just finding out what works for you. Some of our players don't like it. They find it makes them feel worse, particularly leading into a game. There's probably only one or two of those. Majority of our players, we're like you, we have them come in once a week. And they tend to find it works really well. And they get it's a bit of individual preference about what they get treated as well. Like some of them will be, my calves are tight, get regular stuff on their calves. Some of them might be, my back's a bit tight this week. It really is individual preference. But I think the point is there's no downside to it. There's no harm in it, and getting it done regularly.
Yeah. And then Sarah's just mentioned that she's been training with a personal trainer for 2 years, and it's the only time she started running 18 years ago that she hasn't had any injuries. Strength training's had a massive impact. Thanks so much for sharing, Sarah. That's amazing. I think that to me, it just makes perfect sense that you would use strength training as a way to bulletproof your body for running. I think the biggest challenge is just making sure you need to prioritize it, because obviously, well, I'm not sure what your experience has been like, but I imagine with the strength training, if you're training hard, you're not going to then run that day, and sometimes not even the next day. So there's a prioritization required. And I've worked with some runners who, you really need to sell it to them, because sometimes the running needs to come out. And as Emily mentioned earlier, like runners want to run, tennis players want to play tennis, cricketers want to play cricket, football players want to play football. So, for some people, it's like, they really need to understand why it's useful. And it sounds like it's working a treat for you.
The other point to that is that it doesn't need to be 3 sessions a week, an hour-long session. You can get really good benefit from one good session a week, or 5 to 10 minutes of some calf strength a couple of times a week. It doesn't need to be the main part of your program, but you can get it in there in small doses, which will make a big difference.
Absolutely. What are your thoughts on compression garments for recovery, Emily?
We use it a lot. Again, I don't know the research about it, Ben. You might be able to talk more to it, but from our perspective, if it makes you feel better and it helps you get up in the morning and get going with the next session, then there's definitely no downside. And our girls love it. The boys love it as well. We use the full length compression tights, particularly with travel. So on the flight and then overnight, off the back of a flight. And then, off the back of big training days. The players seem to love it. And I think there's no downside to it. I personally have not across the research around it though. Ben, I don't know if you know more around it.
I wouldn't be able to quote off anything at the moment, but I think it's certainly in our environment, it's something that's utilised regularly, and players that's report a really positive benefit from it, both at the time and then the next day. And then Sarah, the financial commitment to the strength training, it's a good way to do it. Sometimes you just got to lay down a bit of money and then you make sure you do it. So that's great. And interestingly, in terms of strength training, there is stronger evidence for it when you have someone when it's individualized. Like it's rather just a generic program, because then if it's a generic program, you don't tend to believe in it the same way as when you got someone who's prescribing it, or it's tailored to what you need. So hopefully you're seeing the power of that. That's great. So brilliant. I think we're all done there by the looks of it. Thank you once again. Thanks so much to everyone for joining. Thanks, Emily, for your insight. It's been great chatting. I've really enjoyed it. Hopefully everyone's got something out of it. I look forward to seeing you all on our next webinar.
Thanks, Ben. Thanks, guys.
No worries. Thanks, guys. See you next time.